Have you ever had a day where your heart was racing for no reason at all, where something felt deeply wrong, but you couldn't put your finger on what? Or maybe it's the opposite. Maybe you've been waking up feeling empty, not sad exactly, just hollow, like the color has been drained out of everything you used to care about. If either of those sounds familiar, I want you to stay with me because what you're feeling has a name, and more importantly, it has an explanation, and it has a path forward. Here's something that surprises a lot of my patients. Anxiety and depression are not the same thing, but they overlap so much so often that millions of people spend years not knowing which one they're actually dealing with, and that matters. Because when you don't know what you're treating, nothing you try seems to work. You feel like something is wrong with you when really, nobody has just sat down and explained it clearly. That's what I'm going to do today. Hi, I'm Dr. Allah. I've sat across from hundreds of patients who came to me frustrated, exhausted, and honestly a little ashamed because they felt like they should be able to just get it together. And every single time, the first thing I tell them is this: what you're experiencing is real, it is medical, and it is not a character flaw. Today I'm going to walk you through exactly what anxiety is, what depression is, how to tell them apart, how they can exist together, and what real treatment actually looks like. Not vague advice, not a list of things to Google. Real, clinical, useful information, the kind I give my own patients. Let's start with anxiety because I think it's the most misunderstood of the two. When most people hear anxiety, they picture someone who worries a lot. And yes, worry is part of it. But clinical anxiety is a full body experience. It's not just in your head, it's in your chest, your stomach, your muscles, your sleep, your breathing. Your body is essentially stuck in a state of alarm. It's as if your brain's threat detection system, which is meant to fire when there's real danger, gets stuck in the on position, even when you're perfectly safe. What does that actually feel like? My patients describe it in a lot of different ways. Some say they feel a constant low-level dread, like something bad is about to happen, but they don't know what. Others have physical symptoms: a tight chest, a racing heart, shortness of breath, dizziness. Some can't sleep because their mind won't stop running. Others avoid situations, social events, phone calls, even leaving the house because something about those things triggers a wave of fear that feels completely out of proportion to the situation. And here is something I want you to hold on to. Anxiety often doesn't feel like fear. Sometimes it feels like irritability. Sometimes it feels like exhaustion. Sometimes it just feels like you can never fully relax, like there's always a low hum of tension running underneath everything you do. Now let's talk about depression because this is where the confusion really starts. Depression is not sadness. I want to say that again because it is one of the most important things I can tell you. Depression is not just feeling sad. Sadness is a normal human emotion. It comes, it makes sense given the situation, and it passes. Depression is something else entirely. Depression is a persistent, pervasive state where your brain's ability to feel reward, motivation, and connection becomes significantly impaired. The clinical term is anhedonia, the inability to feel pleasure in things that used to bring you joy. And that's one of the hallmark signs I look for. Not just are you sad, but has anything felt good lately? Have you laughed recently and actually meant it? Do you look forward to anything? When the answer is no consistently, for weeks, that is a clinical signal I take very seriously. Other signs of depression that my patients often don't connect to their mood include physical fatigue that sleep doesn't fix, changes in appetite, either eating far too much or barely at all, difficulty concentrating, a feeling of mental fog, and a deep sense of worthlessness or guilt that has no logical basis. Some people describe it as feeling like they're watching their own life from behind glass, present but not really there. And then there is one symptom I always ask about directly, because not everyone volunteers it: thoughts of not wanting to be here anymore. This can range from passive "I wouldn't mind if I just didn't wake up," to active "if you are experiencing this, please speak to a doctor or a mental health professional today, not tomorrow. Today, this is treatable. You deserve help." Now here is where things get complicated and where I see the most confusion in my practice. Anxiety and depression very frequently occur together. Studies suggest that nearly half of people diagnosed with depression also have an anxiety disorder, and vice versa. So when my patients come to me saying, "I don't even know what I feel anymore, I'm exhausted, but I can't sleep. I feel numb but also panicked," that makes complete sense. That is what co-occurring anxiety and depression actually feels like. The way I explain it to my patients is this: anxiety is your nervous system running too fast. Depression is your nervous system running too slow. And when you have both at once, your body and mind are essentially fighting against each other. You're wired and drained at the same time, scared and empty at the same time, and that is an exhausting place to live. If this is helping you finally put words to what you've been feeling, do me a favor, save this video so you can come back to it or share it with someone who needs to hear this. So how does a doctor actually tell the difference? How do I know, sitting across from a patient, whether what they have is anxiety, depression, or both? The first thing I do is really listen to how they describe their experience. The quality of the suffering is different. Anxiety tends to come with a sense of fear and urgency. There's a what if quality to it. What if something goes wrong? What if I can't handle it? The person is often restless, on edge, braced for something. Depression, on the other hand, tends to have a heavy, flat quality. There's often a sense of what's the point, rather than what if. The person feels slowed down, withdrawn, disconnected. I also use validated clinical tools, structured questionnaires that we use in medicine to assess the severity of symptoms. Two of the most common are the GAD-7 for generalized anxiety and the PHQ-9 for depression. These aren't just checklists, they're carefully designed screening tools that help quantify what the patient is experiencing and track progress over time. They're not the only tools I use, but they're a reliable starting point. I also look at timeline and triggers. Did these feelings come on suddenly after a specific event, a loss, a major life change, a trauma? Or have they been present most of your life, showing up in different forms? The history matters enormously for getting the diagnosis right. I always do a basic physical workup as well, because this is something that gets missed more often than it should. Thyroid problems, vitamin D deficiency, low iron, hormonal changes, all of these can produce symptoms that look exactly like anxiety or depression. Before I tell any patient this is a mood disorder, I want to make sure we've ruled out a physical cause, because if your thyroid is underactive, no amount of therapy is going to fix how you feel until we treat the thyroid. This is why I always say, please, if you're struggling, see a doctor, not just a search engine, not just a wellness influencer, a doctor who can look at your full picture, your labs, your history, your symptoms, and give you an actual assessment. Now let's talk about treatment, because this is where I see people get the most confused. And honestly, the most let down by the information they find online. The good news is this: both anxiety and depression are highly treatable. The vast majority of people who get the right treatment see significant, meaningful improvement. I want you to hold on to that, because when you're in the middle of either of these conditions, it can feel like this is just who you are now. It is not. Treatment generally falls into three categories, and for most people, the best outcomes come from a combination. The first is therapy. Specifically, cognitive behavioral therapy, CBT, has the strongest evidence base for both anxiety and depression. What CBT does is help you identify the thought patterns that are feeding your symptoms and systematically challenge and change them. It's not about thinking positive, it's about learning to think accurately. It's structured, practical, and it gives you real tools you can use on your own long after therapy ends. The second is medication. I know this is a word that makes a lot of people nervous, and I understand that, but I want to be straightforward with you, as I always am with my patients. For moderate to severe anxiety and depression, medication can be genuinely life-changing. The most commonly used medications are selective serotonin reuptake inhibitors, names like sertraline, escitalopram, fluoxetine. These work by making serotonin, a key mood-regulating neurotransmitter in the brain, more available. They don't sedate you. They don't change your personality. When they work well, patients tell me, I feel like myself again. Medication is not a sign of weakness. It is a tool, just like glasses are a tool for someone whose eyes don't focus correctly. If your brain chemistry needs support, there is no shame in providing that support. The third category is lifestyle, and before you roll your eyes, let me be clear. I'm not talking about bubble baths and gratitude journals. I'm talking about the things that have real, documented neurological impact. Regular aerobic exercise has been shown in multiple studies to be as effective as antidepressants for mild to moderate depression. Sleep, not just getting into bed, but actually protecting the quality of your sleep, is foundational to mood regulation. And social connection, even when it's the last thing you feel like, has a measurable protective effect on mental health. These are not optional additions to treatment. For many people, they are treatment. The honest truth is that most people with anxiety or depression need a combination of all three: therapy, possibly medication, and real lifestyle changes to get to a place where they feel genuinely well. And that process takes time. It takes patience. It takes working with a doctor or mental health professional who knows you and adjusts the plan when something isn't working. You are not meant to figure this out alone, and you are not meant to just cope with it. You are meant to actually feel better. That is possible. I see it happen every day. If you've been sitting with these symptoms, whether they sound like anxiety or depression or that exhausting combination of both, please take this video as your sign to make that appointment. Talk to your doctor. Be honest about what you've been experiencing. You deserve a real answer, and you deserve real help. I'm Dr. Allah. Take care of yourself, and I'll see you in the next one.